Hello, today we're going to demonstrate a sterile wound dressing change. So before you do anything, double check, identify your patient. So go in the room, perform hand hygiene, wash your hands, ask the patient their name and birth date. Check on their wristband. If they check out, you can go ahead and proceed. So introduce the procedure, tell them what you're going to do. So we go up here. This is going to be the old wound, this piece of paper here. So this is non-sterile, taking the old bandage off. So we go ahead and put on just regular exam gloves. And the old bandage, the tape may stick, so we're going to pretend this is a sterile water. We're going to use this to wet the outside of the tape so we can gently pry it up. So we pry up the old tape, remove the dressing. We're going to look at it. Is there any drainage, any redness, edema, ecchymosis, any smell? Does it smell like it could be infected? If not, we go ahead and proceed. So take the old bandage off, we throw it away, then we go ahead and remove our gloves, so throw these away, and we have to get our supplies. So we have 2 packages of 4x4s, they each have 2, so we need 4 total. So we have the saline solution, we need gauze, pair of scissors, sterile gloves, which if you really did this, you would throw away, wash your hands, and start all over and get another package. But all right, so we have all our supplies. Organize our work area. So go ahead and open up the 4x4s. Now they're sterile, so we can't touch them with our bare hands. We're going to open them up like so, left to right. And we want to lay it out and do it this way because we can't turn our back on a sterile field. So alright, so now we get our solution. You would unscrew the cap, place it upside down on the table, and put about a quarter size in the middle of one package of dressing to moisten it. Take the cap, boop, 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 put cap back on. Okay, so now we're going to put on our sterile gloves. You would open away. First package is open away. Grab them. Okay. And these gloves are 3 sizes too small. I don't have any that fit, so we're just going to simulate putting them on. The first pair you would grab here at the rolled up cuff so you don't contaminate the outside. Slide it on your hand. You would not adjust yet. You would take the gloved hand, put it under the cuff of this one, like so, pick it up and put it on. And then once you have 2 sterile gloves, then you can adjust them. They stay up here in the sterile working field. So, alright, you would take the one that was moistened, take it, basically make a tea bag or however you would like to do this, and squeeze out the excess just so it's moist, and put one in each hand like so, and you would wipe from the top to the bottom on the outside of the wound, not touching the wound itself, just like this. Throw it right here, Clean it like so, off the field, off the table, in garbage can or whatever you would have. Take your gloves still, pick them up. You would take the squares, lay the bottom down first, and then overlap it with the top, like so. That way the patient eats, drops something or whatever, it's covered here and they can't get food or debris, whatever else inside it. So now you can go ahead and remove your sterile gloves. So you would pop it up under the cuff, throw them away, whatever. Then you would get your tape, open your tape. You can tear it if it's easy. If not, you can cut it with the scissors. You just want it to look neat, professional, like you know what you're doing, which we really don't, but put it on. And you're just going to do the border on the outside. You're not going to do the entire wound, the entire area. So you would put it there. And then the top here. All right. So one really important thing you would do before you document, you take your marker, you're going to write your name, the date, and the time that you did the procedure. So next time a nurse changes this, if there is any RETA, which is redness, ecchymosis, edema, drainage, approximation, they know the time that has elapsed and they know how long the infection or whatever has occurred. So you would just write your name, data, date, whatever, and just put it up here at the top of the wound like so. All right. And, you know, put the bed in the lowest spot, put the side rails up, patient to call light. Then you would document who did it, time, date, and once again use RETA, redness, ecchymosis, edema, drainage, approximation. You would measure before you did this. I didn't do it to save time so the video uploads faster. But for an open wound, you would take a piece of tape, you would measure the length, not actually touching the wound in centimeters, use centimeters, not inches. Measure the length of the wound, and then a sterile Q-tip to measure the depth of the wound, and then measure against your tape. So you would know basically the entire volume of the wound or the area. And for a closed wound, like a suture, stitches, whatever, you would just measure the length because it's a closed wound. So then once again, bed at the lowest spot, rails up, call light, and document.